Hello, Doc. My name is Abigail Afolen. You are.
Okay, I'm Fiifi Sampah. Yeah.
Right, so I'd like to engage you in a very short interview session. Do you have your permission? So I'd like to inquire more about JAGGREY Infertility and Natural Health Clinic.
Okay, so at JAGGREY'S, we basically treat and manage people who have infertility issues in their marriages. Yeah.
All right. So talking about people not able to conceive, what is it about? When you say infertility, can you throw more light on?
Okay, so before we say a couple is infertile or someone is infertile, so they should have had regular sexual intercourse for a year and at least thrice in a week, and not have used any contraceptive or any method to prevent pregnancy. And as the years advance, so if the woman is above 35 years, then it ceases from being 1 year to now being 6 months.
All right. So the key word here is having sex regularly, at least 3 times in the week. Great. For continuously for a year. But if you're a woman above 35 years, it should be 6 months.
Yeah.
Great. So in our community and our society, infertility is usually attributed to women. Is there any role men also play in not being able to conceive in marriages?
Okay, so that's a misconception. Okay, so when a couple is infertile, so you have 30% being a cause from the woman, and 30% being a cause from the man.
So it's actually equal.
Yes. Okay. And then 30% is when they come together, like not having sex at the right time.
Okay.
And 10% we don't know where the exact cause is coming from. Yeah. So sometimes we have to investigate and know where the problem is coming from.
All right. So when you say not having sex at the right time, what are you trying to mean?
Okay, so what I mean is that usually when you look at the menstrual cycle of a woman, there is a period where she's most fertile. That is where the egg is released. So every woman needs to know her ovulation period. That is a time when your eggs are released. And having sex during that time increases your chance of having a child.
Okay, so to a lay woman out there, are there any symptoms I would experience to make me know I'm ovulating at this particular time?
Okay, so the symptoms are variable.
Okay.
Most of them have slimy discharge during the ovulation period. Some also have a very heightened sex drive. Some too have this sharp pains at their groin region. But then you should be able to calculate your ovulation period. So in a normal menstrual cycle of 28 days, the first day you see your menses, you count from that day to the 14th day. That day is your approximate ovulation day. So if a couple wants to conceive, they should have started having sex on the day 12, the day 13, and the day 14, and probably on the day 15. Because it takes some time for the sperm to travel to the egg. So at least when the egg is released, you should have had sperms waiting, so that when it comes, just
smart sperm,
just capture it.
All right, so let's get this right. So the first day I start menstruating. So let's say
that day.
All right. So let's say my menses last for 3 days. I can start having sex right after my menses, because that will be like the 4th day of my ovulation.
Talking about having sex during the menses, medically, if you are a married couple, there is no restriction to that, except when, for purposes of being clean, you want to have sex during the menstrual period. But after the menstrual period, after the menstrual period, you are allowed to have sex at any particular time. But if a couple wants to have a child, there's a time where you are most fertile, and that is during the ovulation period. When you see the blood, the first day you see the blood, you count from that day.
That's day 1 of your ovulation.
Day 1 of the menses. Then you count on the day 14 is the ovulation day.
All right. So talking about risk factors to infertility. So let's go to men. What are some of the risk factors a man is likely to face to cause him not to be able to conceive?
Okay, so alcohol abuse, smoking, being exposed to heat, so industrial workers, long distance drivers, and radiation exposure, chemicals like herbicides and pesticides. They are risk factors of having fertility.
Talking about preventing these things, is there any caveat this long distance driver, a man working in a very big factory, dealing with huge machines can do to help himself? Because he can't lose his job to get pregnant. So is there anything he can do to protect himself?
In advanced industries, they have breaks, so that you at least have a break from the high exposure of heat and chemicals. So even long distance, at least take breaks and then rest because once the engine heats up, you are more exposed to having your testes being exposed to that high amount of heat.
Great. Okay, so let's go to the causes of infertility in men. Okay. So what are some of the causes?
All right. So let's see the structural causes. That relates to the structures in the male organ. Okay. So there are some males who by genetical means, as they were born, some even don't have testes at all. So such a person, you are sterile.
Testes is the bag where the sperms are stored.
The testis itself.
Where is the testis? Like we want balls, to know the balls where the sperms are stored.
Yes. Some don't develop testes at all. Some also have one testis. Okay. Some have 3 testes. It's rare, but some develop. So these ones, they don't have a high chance of having a child. And also there are some structures. For example, the one that links where the sperm is stored to the urethra, where the urine flows. The vast difference. Some don't develop these organs. So these are structural causes. And some to the blood vessel that supplies blood to the testes. It sometimes has varicocele, where it becomes swollen and then crooked. So blood doesn't flow properly to the testes to develop the sperms. So these are the structural problems. Then we also have infections. Infections in the prostate. Infections in the testis itself. So once you have an infection, it prevents sperms from being produced properly.
So how would one contract an infection to his testes, his prostate?
So through sexual intercourse. So most STIs actually are
STIs, sexually transmitted infections.
Infections like gonorrhea, syphilis, HIV, prostatitis. Even when you have a UTI, urinary tract infection, and it's not treated, so it can develop and spread into.
So how would I know I have an infection in my urinary tract, in my prostate, in my testes?
So basically, you have to go to the hospital, but then you have a symptom. Okay. So usually you have burning sensation whilst urinating. Okay. Or you feel pain in your penis whilst urinating. At times you have pain in your testes. Okay. So it should alert you to go to the hospital. Okay. Then when you're investigated, then you can have a definite.
Are those all the causes? What are some of the other causes?
So there's something about the sperms. Okay. So low production of sperms, abnormal sperm structure and size. So some sperms are too big. Okay. The head, so the sperm has a head, a neck, and a tail. Okay. So some have a big head, a smaller head, a big neck, smaller neck, 2 necks, 2 heads, 3 tails. So all these abnormal structure of the sperms leads to infertility.
Let's talk about women. What are some of the risk factors women are likely to face to make them not able to conceive?
Okay, so same with the men. Okay. Alcohol and smoking is a major risk factor for almost every medical condition. Right. So that also also plays a role, and obesity. So obesity, that is being overweight. Okay, it makes you more risk of having an ovarian cyst. Okay. Yes. So these are the very main ones that we have with them. But the causes of infertility in women, we can talk about the ovaries not functioning properly.
When you say ovaries, the eggs.
Yes.
The structure that produces the eggs.
Yes. So some don't have the ovaries working properly. So there are hormones that regulate the ovaries. Some don't have their hormones in the right amount. Okay. So they have ovarian insufficiency. So for them, the ovaries don't even produce eggs at all. And then some also are producing the eggs, but it's not being released in the ovarian cyst and ovarian when you have a lot of ovarian cysts, it becomes a polycystic ovarian syndrome. Okay. So for them, they have long periods of not having their menses at all. And any woman who has a regular cycle then there's a change. So let's say you used to bleed for 7 days, now you are bleeding for 5 or 4 days. It happens just in a month. You must go and investigate why it's happening. So you miss your menses for a month or 2. There's no pregnancy. You must also go and investigate, because it could be a problem with the ovaries. Okay, and also some are producing the eggs, but then because the tubes may be blocked from an infection, or some don't even develop tubes at all, so then the eggs are not being transported to be the sperms. Okay. Yes, so these are the main causes. Okay.
How about infections? There were infections for the men. Are there infections for women?
Okay, so there's a pelvic inflammatory disease. Okay. So any infection that reaches from the vulva, there's an opening of the vagina that flows from there to the cervix, to the uterus, into the tubes, to the eggs. It's called a PID. Okay. So it's one of the main causes of infertility in women, but it's very easy to treat. Okay. So for women, they have pain during sex. Okay. That's one of the main symptoms. You must come and be investigated. It could be a PID.
Discharges from the vagina, foul smelling.
Offensive smells.
Right. Yeah. Oh, okay. So, other causes of infertility in women. Are we exhausted? Fibroids. People say when you have fibroid, you can't conceive.
Okay, so the fibroid itself is not causing the infertility. Okay. But then it's like the fibroid is competing with the space where a baby can develop. Okay. So a woman can actually conceive with a fibroid. But just that the fibroid would take, so the hormone that grows the fibroid is that which grows the baby as well. Okay. So as you maintain both there, the fibroid increases in size,
the baby also increases.
So one has to come out. Usually it's a baby that comes. So they have recurrent miscarriages. Yeah.
So does it mean that with fibroids, once I take off the fibroid, I can now conceive?
Yes. So if the only problem was the fibroid, when the fibroid is removed surgically, then you can conceive.
All right. Okay, so we want to reach out to the public. If there is somebody out there who would like to visit JAGGREY'S Infertility and Natural Health Clinic, how would we find our way here?
Okay, so currently we have 2 branches. Okay. One in Kumasi, one in Accra.
Oh, nice.
So the Accra branch is located at Adenta SDA. Okay, and it's actually a top 15 school. Okay. But we have contacts that when you reach us, we can get to you. And the Kumasi branch is located at Krono. Okay. It's adjacent the Adongo factory.
Okay.
Yes.
All right. So what happens at my first visit? Do you just zoom in to investigate me, what is happening to me? Do you take my details? Okay. Do we establish rapport? Do you admit me? What happens?
Okay. So when you walk into JAGGREY'S, so you meet very skilled health professionals. Okay. And then after seeing the nurse and you see the doctor, your history is taken. So we take a detailed history, your personal medical history, and your sexual history. Okay. And then from there you do some labs that way, and then from there we diagnose you and then start treating you.
All right. So do you have specialists for men and specialists for women, or is the same person that would attend to both? Say if I come with my husband, is it the same specialist that will attend to both myself and my husband?
So they're the same person, but when the man needs a special treatment, then we have specialists for them as well.
All right. All here in JAGGREY, or
yes.
You say?
No, all here in JAGGREY.
Wow, so it's like a full package in here, huh? Okay, so if I want to ask more questions, inquire more about JAGGREY'S, are there any contact numbers I can reach you on?
Okay, so if you look at your screen, you find some numbers you will in.
And then my last question, do you just do medical treatment, or sometimes if my condition requires surgery, do you do surgeries or you refer?
Okay, so we don't do surgeries here.
Okay.
But we have link hospitals where you want to do a surgery, we can refer you there.
Qualified.
Yeah, qualified places.
Right. Okay. Thank you very much for your time.